So thank you for coming in today, and thank you for coming throughout the year and helping us with this protocol. The Memory and Aging Center, we've been growing. Our team is getting bigger and bigger, and so is the need of having a more diverse research population that is more representative of our community. And our program has really three main goals that drive our work. One is service. We believe that by extending clinical care services, neurologic especially, through community clinics and using culturally appropriate assessment in clinical care is a big tool, right? If we can provide service to our communities right in their neighborhoods, it's going to be different, right? For those people who do not have access to coming for our clinic here. Another one of our goals is education. We will really want to improve brain health education among our community. We believe that we can contribute to decrease the prevalence of neurodegenerative diseases if we can just spread the word about how to keep your brain healthy. And you have in your handouts part of the educational material that we use in the community. We also have a curriculum, 5 to 6 sessions, and we talk about how to keep your brain engaged, how to, exercise is important for you, nutrition, diet, and we think, it's not that we think, right, it's been proven that some of those lifestyle factors are associated with a increased risk of dementia. And our last goal is, for sure, stimulate the participation in research of the underrepresented groups. We believe that by improving the enrollment in research of the underrepresented population, we can improve the health of our community, and also we can hopefully improve the health of our communities back in our countries of origin or throughout the world. Right? I just want to tell you a little bit about what the work we've been doing. We did in 2016. The Chinese cohort has a very long-standing relationship with the Chinese hospital, the Chinatown Public Health Center, and we provide service, clinical service education, and also this sites help to help us to recruit and to make clinical referrals for our clinics. We are going to start a relationship with Mission Neighborhood Health Center this year, so we're very excited about that. And there are other agencies that work with us, right? Either on education or that act as referral sources for our services. And we're very excited to keep fostering those relationships. Okay. So right now, as of today, this is how the demographics of our cohorts look like throughout the map. Right? We have a total active of 960 participants. 66% of that reports being Caucasian, but we have a 10% that reports in Chinese and a 6.7% that has Hispanic origins. We have there are other ethnicities and that are very underrepresented, right? But we're working towards that. And then since 2014, the enrollment of underrepresented groups has increased significantly, and out of 635 new participants that we've enrolled in 2014, 15, 16, and 17, 384 are Caucasians, and then 41 Chinese, 36 Hispanic, and 17 are report being African American. So we are working slow work, but we're very confident that we're going to be able to increase these numbers even more throughout the years. And what are some of the lessons that we have learned working out in the community with underrepresented groups? Trust is a key component, right? It works when they see that you're dependable and that you're consistent, and it makes a really huge difference, right? And when you build that bond and they are able to trust that you're doing the best that you can, and then you're doing it because you want to help. Service is a great tool to reach out to underrepresented populations. Some of them, again, do not have access to regular healthcare services, right? That, like the memory and aging clinic here. But if we go right to their neighborhoods, it's better, right? You're able to reach out to them where they feel more comfortable. The other important thing is learning about the population we serve. It's crucial. Sometimes we think that their needs are this, but actually you go there, talk to them, and their needs are totally different. So it's important so we speak the same language, right? And adapt different strategies work for different groups. I work mainly with the Spanish speaker participants, and they love our educational programs, and they love health fairs, so that's the main point of contact that we have with them. Respect is very important. All of us have different, all of us are different, and we try to promote education while respecting those differences. Care is, I can't emphasize how important it is, truly, genuinely care about the population we service. And the teamwork and the multidisciplinary approach are essential. A lot of these populations need to be in contact with other resources, right, in the community. So when you establish partnerships with other community agencies, then that makes the outreach easier, and it makes and enriches the relationship. And finally, thank you very much. I want to thank all the community outreach team. The coordinators and the PIs are awesome. We work on weekends, we work evenings, and it has been truly enriching to work with so many different people. I'm sorry if I'm missing some of them. Our work is also supported by the Global Brain Health Institute, so we've been working a lot with the fellows as well. But thank you very much, and slowly we're gonna keep growing. And remember, if you ever think you're too small to be effective, you've never been in bed with a mosquito. So it's